control the rotation of the needle, you can make any path. You can steer. So you can, for instance, here the surgeon can only insert the needle here, and he has to reach a target here. With all these obstacles, with a rigid needle, it's impossible, and with a flexible needle, you can design something. Also, this is an extreme case, of course, but even with a conventional prostate biopsy, surgeon, it's a straight line, but since even the rigid needle, they bend a little bit, it's difficult for the surgeon to steer and get exactly the point. So,
and how do you follow the needle? Is this by X-ray or?
So that's one point. Until now, with those flexible needles, most of people around the world, they use visual cameras and transparent phantoms. But here we developed some ultrasound guide. So for us, it was great. We could able to perform experiments in biological tissues, and clinical application is clear than using visual cameras. So the idea is like this. We have the needle tip, we position the ultrasound in the same plane of the needle tip, and as we insert the needle, the ultrasound follows. It's you can see right now in the video. So we have the
but this is in a uniform material, but when you have real
tackle here. One is controlling the needle, rotation and so on. The other one is what you said, this is an homogeneous phantom, and how much the needle will bend in a human tissue. All the properties changes a lot depending on the patient. Even the same patient can vary. So that it's what I'm researching now is how to estimate this online. I did some promising results using the chicken breast. I could be able to define it online. And the other one is defining the best path. So in this extreme case, for instance, going from here to here, which is the best path? Doing this, making like here, or I don't know. We can. So here, I'm more focused in controlling the needle and needle tissue interaction. And we are using a path planning algorithm that has been developed by some colleagues in the University of California. And we have a very close collaboration with them. So always when they design something new, they send to us to test because they don't have an experimental setup.
Okay.
So for us it's really nice. So here first
So this is the ultrasound device?
Yeah, the ultrasound probe. I put it in order to see the tissue. So I define here, and I start inserting the needle until I see a small dot there at the middle, and then now you can see. Then I stop. So this is the needle, and now I can steer. So here is entry point, target. This is a basic experiment. So I put here an obstacle.
An obstacle, yes.
Yeah, but it has to contour the obstacle and reach. And you see that the blue line is the best path.
So this is done automatically. There is no human intervention.
No.
Okay.
No. And all this is the blue line is the path. You see that it changes. So it's doing online. Even if we move the target, it will computate online. Okay. So imagine if the patient moves or something, or breathing motion, and I reach the target. If 0.2 accuracy, this was really slow. Usually it's around 0.5 millimeters. And wow. Very welcome.
Die kant op?
Ah, okay.
Dat weet ik niet, want hier kwamen ook mensen.
It will take some time just to initialize, but we can move it. My only problem of staying the whole day doing experiments is because this is mainly made of gelatin. So in a few hours it might start melting.
Okay.
Not melting, but it will be a different type of tissue. Come on, let's go. check if it's right. So I just position the ultrasound. Then I can see the This is the phantom. I will insert the needle, and then we should see a light dot here. It's the needle tip.
Right.
It's like this. The needle tip is crossing the ultrasound plane. So I know, and by the position of these and tracking the position of this dot in the image, I can estimate the 3D position of the needle. And here is the entry point. Blue line is what we calculate as a best path. And we calculate this online, so even if the target moves, the obstacle moves, it's always recalculated. But of course the path, it will depend on the maximum curvature that the needle can do. If the path is here, I cannot reach it. So this is a basic test. So and then it reaches this time, how much was it first?